Once the chemotherapy has arrived on the unit, I've already done my checks of the actual order. Now I'm going to check that the order matches the chemotherapy, which also matches our MAR. So I take the chemotherapy, I look at the orders, I'm going to look at the name, the date of birth, and the account number. Then I go to the chemotherapy, in this case it's cytarabine, 190 milligrams. This is in 500 mLs of dextrose to infuse over 24 hours at 20.9 mLs per hour. I also verify that it has not expired. Now I'm going to take the medical record, I'm going to go to cytarabine. I right click and hit order info. I'm checking that this is a correct patient's name, date of birth, account number. I go here, this is the correct drug, cytarabine. The dose is 190 milligrams. It's the correct route, IV piggyback, date, time. This states to give it over 24 hours at 20.91 mLs per hour. If I hit the pharmacy button, I can see the diluent, which is dextrose, 5% in 500 mLs. Then I go to the next chemotherapy. I check that the order, again, I go to the patient's name, date of birth, account number. In this case, it's idarubicin, 22.8 milligrams. The route is IV push to administer over 15 minutes. Then I check the date. Now I go to the medical record. I hit order info. I'm checking the patient's name, date of birth, account number. We've got idarubicin, 22.8 milligrams. IV push, it's the correct date. Again, it states over 15 minutes. In this case, there is no diluent. Now I'm complete with this check. I'm going to go get a second chemo RN to do the double check.
As a second chemo RN, I'm going to come in and I'm going to do a complete independent check of all the things that the first chemo RN checked.